Good morning and welcome to Virginia Abilities Mental Health webinar, bringing hidden disabilities to light. I'm Bob Lancaster. I'm the chair of Virginia Abilities, so glad you're joining us this morning. I know we have a very diverse audience and a challenging topic. So what was once a mostly unmentionable subject in the workplace is mental illness is now very much in the spotlight. It's in the news every day, and it's affecting people's personal and work lives. And before I introduce our first presenter, I'll share a brief personal experience, maybe help to provide a little context to the webinar today and give you some things to think about for your own your own experiences and within your own organization. So probably about 8 years ago, I had the experience for the first time of having a staff person with dealing with anxiety and depression. And certainly back then it was very much an unmentionable subject. But as part of an employee resource group, we started the conversation in our organization, and it was really helpful to just have the conversation to understand what people are going through. Because from my perspective as a manager, I was seeing some difficulties with an employee, and immediately, thinking, this is a performance problem, and not really thinking about, what can I do to help the individual through this, a challenge in their life. And so, the employee resource group, our company culture was open to having those conversations. And so when we came into the pandemic, the organization had broadened a lot of those conversations. We were having Let's Connect meetings where people were sharing their own personal stories. And so just allowing that in your organization was tremendously helpful. And as we entered the pandemic, and I had another situation last year during the summer where an employee was struggling, and she felt open to, letting me know that she was having some problems, wasn't up to, performing up to par. And I knew this was a very strong performer, and I was able to, at least help her through with resources. I knew there were certain questions I couldn't ask, but at least I knew, hey, our organization has resources available to you. Take the time you need to work through this. So those experiences, over the years have been very helpful. And as we, look at businesses reopening, employees coming back to work, they're used to working mostly remote, and maybe not having to face their manager employees in person with some of the things that they've potentially been dealing with in the remote work environment. So, is your business ready to reopen, and are you prepared with this new reality and the challenges that come along with it? So I'm excited with our presenters today and our panel discussion at the end. Before I introduce our first presenter, I want to remind you to enter questions in the control panel. So the GoToWebinar, there's a control panel. You'll see a bar with questions with an arrow by it. You can open that up. You can enter questions at any time. Our first presenter is going to go through for about 45 minutes. And then we will go into a panel discussion, and we will go back and go through all of the questions. So, keep in mind your questions, about your specific situation, about your organization, will be very helpful to others. So as you're listening to our first presenter, Kristen, please pop some questions in the question box, and then we'll address those when we get to the panel. To introduce our first presenter, Kristen Hamilton. Thanks for joining, Kristen. Kristen is a vocational rehab counselor with the Virginia Commonwealth University Rehabilitation, Research, and Training Center, RRTC. Kristen has experience working with individuals across disabilities, including those with reoccurring mental health challenges, and in particular, experience implementing coping skills and building resilience. So anyway, welcome, Kristen. Thanks for joining our webinar today, and I'll turn it over to you.
Okay, great. Thank you so much for having me. It's a pleasure to be here. And thank you, Bob, for sharing that story. I'm sure that's helpful to hear for some of our viewers today. And much like Bob had mentioned, we are going to be addressing some of those, tough questions and tough situations in the workplace. So let's go ahead and get started. So of course, today we're going to be talking more about supporting mental health wellness in an employment setting. Okay, and some of our key points that we're going to touch on today would be some common mental health disorders, dimensions of wellness, signals of distress at work, strategies to promote a wellness work culture, building a resilient workforce, and returning work tips for readjustment, as well as how to maintain that positive change. So first, let's talk about what mental health is. So according to the World Health Organization, mental health is a state of well-being in which an individual realizes their own abilities, they can cope with their normal stressors of life and work productively, and is able to make a contribution to their community. Mental health is comprised of different components such as our emotional, psychological, and social well-being. It affects how we think, how we act. It also helps to determine how we might handle stress and our problem solving capabilities and making choices. So it makes sense that, an employment setting where we spend a lot of our time each day can have a significant impact on our mental health. So it can either promote well-being or it can alternatively trigger some challenges or problems. So some common mental health disorders you may or may not have heard of would be a depressive disorder or anxiety disorder. So that could include panic disorders, generalized anxiety, maybe OCD, obsessive compulsive disorder, or even some social phobias or social anxiety. Some other ones you may be familiar with would be substance abuse, attention deficit disorder, some dissociative disorders, eating disorders, or post-traumatic stress disorder. So I feel that with PTSD, it's often associated with veterans who may have experienced combat, but however, PTSD is a lot more common than we realize, and many people are still experiencing or have experienced PTSD symptoms due to the hardships that the pandemic has had on us globally. Okay, so the prevalence of mental health. The pandemic has and was a traumatic event for many of us, and it's had a significant impact on the prevalence of mental health in a significant way. So since March of 2020, depression is higher, it's more prevalent, and that number continues to grow throughout the pandemic and is right now at an all-time high. Since September of 2020, 8 out of 10 individuals have endorsed symptoms of moderate to severe anxiety. And so that's significantly high. Also, Virginia ranks number 4 with 17.38% of adults experiencing mental health illnesses. So one important takeaway from the pandemic is that, there is a lot of mental health awareness that's coming to the forefront, that's being highlighted, and that's wonderful. However, I believe there is a huge misconception about mental health support, and it's not about acting in crisis. However, it should be a proactive approach. And I believe that in order to better understand how we can be more effective in our proactive measures is to understand the various dimensions of wellness. And so you can see my illustration to the side here kind of shows the continuum of mental health. And I feel that many of us were either in the yellow to orange or even red zone and still may currently be in that place. And so it's really hard, or it can be challenging for us to really implement protective factors and build and enhance our protective factors when we're kind of in those in that part of the continuum, in that in those stages of, you know, mental health. Okay. All right. So as I just mentioned before, mental health is a state of wellness, and it is comprised of different components and dimensions. So it's important to try to achieve balance in these different dimensions. And it's not something that we're going to maintain balance in every single dimension consistently. That's probably humanly impossible, and that's okay. However, you know, when we're thinking about these 8 dimensions, I can provide some examples of what maybe a more balanced approach would be. So if we're looking at physical, being able to recognize the need for physical activity and healthy foods and sleep. And then emotional wellness, being able to coping effectively with life and creating satisfying relationships. Financial wellness might look like satisfaction with current and future financial situations. Intellectual wellness may look like recognizing creative abilities and finding ways to expand knowledge and skills. Occupational wellness, being having a personal satisfaction and enrichment from your own work. And then we have environmental wellness, being able to have, you know, good health by occupying pleasant, stimulating environments and a supportive well-being. And then we have social wellness. This could look like developing a sense of connection, belonging, and well-developed support system. And our last one would be spiritual. So expanding a sense of purpose and meaning in life. So in thinking about these 8 dimensions of wellness, I encourage you to reflect on how the pandemic may have impacted your own personal dimensions, and how they may continue to be impacted by us readjusting to a new normal. Okay. So the pandemic's impact on mental health. Some of the common symptoms or challenges that, or feelings that may be exhibited by some individuals would be an increase in anxiety or feelings of uncertainty, perhaps feelings of loneliness and sadness, changes in eating or sleeping patterns, changes in substance use, as well as potential exacerbation of existing mental health or medical conditions. So I'm sure that we can all relate to at least one or more of these specific examples of how the pandemic has affected us, especially for those that may have had the virus themselves or have had a very close loved one to be impacted by the virus. So as we continue to move forward through the pandemic, many of us are preparing to transition back to working in person. And if we have not already done so, let's take a look at some of the ways that employers and managers and other staff can be mindful of, and maybe some of the things that they should look out for when working among their employees. So some of those would be signals of distress at work. We want our employers to be familiar with some of the telltale signs and signals of distress at work, such as absenteeism, high turnover, or frequent tardiness, Also, maybe burnout. So according to the Mental Health of America, 4 in 5 employees feel emotionally drained from their work, which is an early sign of burnout. We also want to be looking at low production rates. 65% of employees find it difficult to concentrate because of their work environment. And this has changed compared to the 46% of employees in 2018. Another sign of distress at work might be low production rates, safety risks and accidents, poor communication amongst employees and management, lack of cohesion and motivation, and employees not feeling autonomous. Some observable behaviors might include difficulty concentrating, making decisions, or remembering things, working excessive overtime for a prolonged period of time, frequent statements of feeling tired, possible complaints of aches and pains that are unexplained, lack of cooperation or general inability to work with others, and potential alcohol or drug abuse. So with natural stressors of work and the impact of the pandemic, it is imperative that businesses are taking the necessary steps to support their employees. So one of the individuals that I support in their job, as a vocational rehabilitation counselor, was significantly impacted by the pandemic. This individual has autism as well as an anxiety disorder, and he needed significant support transitioning back into his workplace, which happens to take place in a hospital. And so as a employment specialist, I was able to, work with his employers to kind of give them those signs and cues of, potential burnout and what that may look like in him. And so that they were able to better support him when he possibly needed to just take a break, or, take a few minutes to go outside and get some fresh air, things of that nature. So it's important to be aware of what those early signs are. So again, we can have a proactive approach and helping to manage it and helping to support our employees. Okay, so promoting a wellness workplace culture. It really starts with leadership and practices and disclosure, setting an inclusive climate and a supportive tone, creating mental health opportunities in the workplace, and creating company cohesion, but ones that also foster individual needs. Promoting positive wellness within a work culture helps to empower employees, in which that can turn into an increase of higher productivity and motivation, as well as reduce absenteeism, improve health insurance costs containment. It can increase loyalty and retention, as well as increase diversity, acceptance, and respect in the workplace. And so down here in the corner, I have a visual of the 4 A's of mental health friendly workplaces. So one, just bringing awareness. So building that awareness in a supportive culture, being able to provide the necessary accommodations to employees, as well as assisting them, connecting them to some of those resources, and making sure that they have access to those resources. If there are some barriers, let's find out what those barriers are in order to, work through them. One of the A's that I feel like should be included in this would be acknowledgement as well. It's important to acknowledge our employees. For many of us that have worked throughout the pandemic, that have been fortunate enough to work throughout the pandemic, it's not been an easy road. And so I think acknowledgement can go a long way, and employers should, be mindful about rewarding good work. And if there is a lack in productivity, let's take a problem solving approach to it rather than just assuming that someone's unmotivated. And I felt that this was important to note in this presentation. So supporting disclosure in the workplace. As employers and managers and human resource professionals, it is important to promote disclosure of any mental health or medical conditions an employee may have. So employees are not required to disclose. However, in order to request a reasonable accommodation, it is beneficial that they do in efforts to be able to receive that appropriate support that they may need. And so you have an employee that is wanting to share perhaps that they have a panic disorder and they've been experiencing more frequent panic attacks. They've been working remote and now, the expectation is that they come in person, and they have some concerns about, potentially having panic attacks at work. So what do we do? Well, first we would want to thank that employee for sharing. We want to listen to what they have to say. We want to be supportive, and get them the necessary supports that they may need, but not overpromise. We want to keep the accommodations and expectations reasonable. We want to absolutely maintain confidentiality. That is extremely important, especially with employees that are disclosing. And so if you as a manager are expected to have a conversation with HR about this, then that's something that you might want to let that employee know as well, so that they're prepared, and not just thinking that their disclosure is going to stay in between the two of you and that conversation that just took place. So again, just kind of being familiar with your company policies when it comes to disclosure, such as that, and consider what changes you can reasonably make. Ask help from others. So for leaders, connect to other leaders, and get support and ask questions about how they've handled situations like this in the past. Of course, not using names and keeping information very vague, but seek out counsel, and how to go about with best practices and what's ethical. And then, of course, as I mentioned before, just understanding your company's policies and employee assistance programs and other resources that your organization might provide. And so again, going back to my example of my client that I work with, he and I had spoke about his anxiety, and he was comfortable with us going to his manager and sharing that information. So that was a conversation he and I had prior to, and he led the conversation. I was there for, to support him. And it was great. It was a great experience. And he's since been comfortable with me conversing with that employer when things come up. And so, it's really helped to strengthen that rapport between all of us. And I think it's helpful for him to know that he, has a support team. And so when he is having tough times, and his anxiety is, significantly impacting him, he has other people that he can rely on, and his job is not in jeopardy. So as I mentioned before, some of those reasonable accommodations could be something simple as schedule modifications or job task modification. So that might include, if you have a individual who struggles with social anxiety, but does really well on, the back end of, administrative work. Perhaps, working with them on excluding certain tasks that might require them to, present in front of the office or whomever or a group of people, and taking somebody else who has a strength in that area and having them do that, just would be an example of a job task modification. Modifying physical environments. So perhaps somebody could benefit from a standing desk because they might get anxious from sitting down all day and need to move around. Promoting utilization of peer support. This one is very important and very reasonable. Encourage your employees to build rapport and get to know one another and be able to rely on one another and support each other, as well as scheduling more frequent check-ins. I feel that it's important as a manager or even HR staff to create more time in your schedule to provide those check-ins, even if it's just once a week, once every other week. I believe it creates that space for an employee to build trust and build rapport and feel more comfortable coming to their employer should challenges arise. Also, provisions of assistive technology. This could be something simple as, having headphones in while working, as long as it's not a safety hazard, being able to wear headphones that, potentially are noise canceling so they can focus on their work more easily, could be a reasonable accommodation, as well as changing and supervising techniques. So one of the supervising techniques that kind of come to my mind is, learning more about informational interviewing, being able to ask open-ended questions, be supportive, reflect back to the employee what you hear them saying, asking for clarification. And so with more open-ended questions, it helps to foster more conversation, more in-depth conversation, and tends to leave biases or assumptions out. Another way to promote a positive wellness work culture would be to combat mental health stigma. So only 5% of employees strongly agreed that their employer provides a safe environment for employees who live with a mental health illness. So there has been a lot of stigma in the workplace around this. Mental health stigma is a barrier to well-being. It holds employees back. It deters individuals from seeking help, and it causes discomfort for returning employees. So some ways that, and strategies that we can do to combat that would be to educate employees about the signs and symptoms of mental health conditions, possibly sharing with them those signals of distress that, we talked about previously, some of those observable behaviors. Encourage employees to talk about stress, workload, family commitments, and other issues. I feel like the pandemic has afforded us that opportunity. We're getting into a place where we can normalize some of those things, and everybody has something going on, and just creating a support system and being able to help our colleagues problem solve would be incredibly important and helpful. As leaders, communicate that mental illnesses are real, they're common, and most importantly, they are treatable. Discourage stigmatizing language, including hurtful language such as crazy, nuts, or insane, and requiring disability etiquette trainings and practices. So, again, as leaders, modeling that to your employees, not using, hurtful language or insensitive language, using people first language. So for example, instead of autistic person, you would say individual with autism, or that depressed individual, someone that experiences depression. And so again, by doing that, it may sound simple, but by doing that, you're really putting the power back into the person and acknowledging that person first, and then their challenge or diagnosis second. So strategies to build a resilient workforce. First we want to understand our employees. And by doing that, we want to learn more about the work-related stressors that impact our employees the most. And this can be done through, surveys. Employers are actively working to improve workplace practices and cultures, and it is important to integrate that resilience training for their employees. And resilience training can help employees to handle stressors at work better, as well as develop protective factors against stressors. As I mentioned, we want to be able to understand our employees, understand what are some of their triggers or common stressors that impact their work. We also want to engage leadership. So again, to build a resilient workplace, it starts with the leaders. It starts with leader buy-in and leaders role modeling the practices, as well as having them become more involved. Share results of the surveys that you may distribute, and talk about it amongst employees and as a team. Then we want to facilitate the resilience training. And so that can be done in the job or prior to returning to work. Innovative strategies to improve employee health and organization performance can be the focus. And so some of the trainings can focus on other areas such as managing emotions, dealing with conflict, staying calm, guarding against burnout, as well as improving communication skills. And that's just some examples. This resilience training can really be a lot more than that. There's a lot more areas of resilience and factors of resilience that the trainer can focus on. And so, lastly, we want to model the implementation of those resilience building exercises. So, promoting basic self-care, deep breathing exercises, relaxation techniques, or grounding techniques. So again, going back to my example of my client that works in the hospital, some of the things that I worked on with him is implementing deep breathing techniques, grounding techniques. So whenever he is experiencing some of those like signals of distress, for him, we call those warning signs. He's able to excuse himself, go do some deep breathing exercises, some grounding techniques, which might just be, some tactile things like holding ice in your hands, that helps to kind of just ground you and bring awareness back to the present. And that's especially helpful for those that might, experience anxiety or panic attacks. So those are just some, basic examples of ways to build in some simple exercises that can promote some of that resiliency. So resilience contributes to improved self-esteem, since it provides a sense of control over life events, and also provides a greater job satisfaction, and employee engagement. And this, like I said before, this training can be done, virtually prior to the return to office, as a proactive measure for employees that have potential concerns about returning to work, and how to manage feelings and emotions that may come up once they have are in that transition. So, which brings me to my next point: returning to work tips for readjustment. So we want to be able to facilitate open discussion about concerns or fears. Again, this depends on the organization, but this can be an open group discussion, or make it a individualized private discussion with you and every employee. Support any disclosing of mental health challenges. Encourage feedback from employees regarding returning to work. Communicate with each of the employees to formulate a plan of action based on their individual needs and the needs of the business as well. As I said, discuss various options, perhaps like a hybrid option, working from home some days, slowly integrating back into the office just a couple days a week. Whatever is going to work best for you as a business, as well as the employee, based on their individual needs. We also want to manage employee expectations when it comes to being in the office and being in community spaces, hand hygiene, PPE, all of that. So maybe, having a more solid plan to be able to share with the employees would be beneficial prior to them returning, so they understand what the expectation is. Could alleviate some preemptive anxieties or fears. Also, make time and space to provide check-ins with your employees. So, kind of go into it remembering to carve out time within your schedule for check-ins with each employee. Again, to just show support and create that space that'll allow you and your employee to, again, build that rapport, that trust. And most importantly, just open communication. I can't stress that enough. Direct, open communication, and opportunities for your employees to feel heard as well, whether that's, again, through open discussions, surveys where you receive feedback, or individual meetings. So I felt that this was also an important tool to mention. So, when returning to work, some people might not feel as comfortable with expressing those concerns. Maybe they would like some anonymity around expressing those concerns. So utilizing a survey to get a baseline of some of the stressors or concerns that employees have would be a great way to understand what direction the organization could grow in. So tracking progress of employee engagement surveys, using mental health calculators to estimate the prevalence and associated costs of untreated depression and alcohol and substance abuse within your workplace. As I mentioned, consider using surveys such as work limitations questionnaires. They have a brief job stress questionnaire to measure how your employees' health and stress levels affect their productivity. And there's more surveys that can be found online that might best fit the information that you're trying to gather for your particular business. Again, just monitoring absenteeism and turnover rates, employee productivity, analyzing healthcare and disability costs, and company mission connects with the community. So again, just kind of reevaluating, what is your mission? What is your goal for the company? And, how are you exemplifying that? And how can you get the community involved in that also? So, we want to maintain this positive change. We've, made the efforts to create a more positive workplace wellness culture. How do we maintain that? Again, surveys, they help. They help to give you a baseline, and they help you to understand and to understand as well as measure growth in a quantitative way. Also provide resources, employee assistance programs. HR, I'm sure, has more information about this. If you aren't currently knowledgeable about what the EAP offers, become more familiar with that. I also encourage you to establish a diversity and inclusion committee within your organization that consists of leaders and employees, and so that everybody is represented and can have a space to voice their opinions and strategies of change, as well as workplace support during life adjustments. Being more familiar with those policies, reassessing how can our policies potentially change to better support these life adjustments, and also professional learning opportunities such as this one, and many others. I'm going to be sharing some resources on the next slide that also provide professional learning opportunities. So working with consultants to talk to your employees about various mental health topics, working with job coaches or employment specialists, and becoming familiar with the local crisis centers in the event that there is a crisis that occurs at work. There's several different within the Richmond area as well, so becoming familiar with those businesses and centers. So, and again, just making mental health training mandatory for your company leaders, that will help them to be more aware and invested in this aspect of employees' well-being. So here's some resources that I pulled some information from and that I, frequently use. The Job Accommodation Network is a great one, as well as the NAMI and the American Psychiatric Association, and some more local ones would be DARS, the Virginia Department of Aging and Rehabilitative Services, and the Virginia Association of Community Services Boards. So all of these resources have a lot more information if you're looking for it in terms of how to continue to support employees readjusting into the workplace post the pandemic, or during the pandemic, and they can provide more information as well as some of those surveys that I was talking about. So I encourage you to do your research and look more into it. And lastly, let's connect. So I have my email down there. And again, my name is Kristen Hamilton. I'm a rehabilitation counselor for VC's Rehabilitation Research and Training Center. So thank you.
Kristen, thank you so much. Very, very informative. I know you're going to stay on for our panel discussion. I put in the chat to remind participants to please enter your questions into the questions box on your control panel. A couple of things I noted, Kristen, during your presentation. And also, I will mention that the presentation, hard copy, and the video will be made available out on our website. We have a YouTube channel, so that'll be pushed out. We'll notify participants when that's ready. But the idea that mental illness is a continuum, and as with any disability, it can strike any of us at any time. And my example I shared with my employee last year was, a very strong performer, and the pandemic, the civil unrest was, just too much for the individual to handle, and so she needed support. So at any time, it can strike any of us. Resources are available. You had a great list, Kristen, And resources are available through Virginia Ability with many of the, partners like RTC and DARS that we work with. So feel free to reach out to Virginia Ability. Our website is virginiaability.org. There were two things that you said that I noted, and both really being proactive. One is a willingness to have the conversation. I mentioned, in our organization, having these Let's Connect calls were led by our leadership, and individuals were encouraged to share their stories, both anonymously and many people, on the calls. And these were not, these were audio only calls. So we didn't do webinars, but people shared their stories, and it just reminded us that we're not alone in going through these struggles. So, but the organization at the leadership level really has to, be willing to start that dialogue, and make sure you have a culture that's open and willing, to invite the conversations and to support your employees. And the other was that to make sure that your employees, do have the resources, they know where to find the resources or who to go to in your organization, especially like the employee assistance programs. If you don't have that, there are many resources outside of your organization that you can leverage, but make sure your employees know where to find those resources, right? We want to build a resilient workforce, especially in today's employment, sort of unprecedented. One, unemployment, but two, you've got people leaving their jobs at record rates. So, finding good qualified people is going to be a challenge for a time to come, and supporting the employees that we have is going to be really important. So build a resilient workforce. So Kristen, thank you very much. I would like to introduce our next two presenters, and we'll start the panel discussion. So we have Lisa Clark. Lisa is a recruiter, senior talent acquisition with Anthem. And Lisa is passionate about helping our military population and with barriers to employment. She was also previously director of employment at Goodwill Industries, and worked hard to assist all types of barriers to employment. So welcome, Lisa. I think your Anthem experience and your supporting barriers is going to be really helpful to the participants on this webinar. And then also welcome Mark Hicano. Mark is a managing director of Major Lindsay in Africa, the global navigators of legal careers. Mark is passionate is a passionate advocate for mental health and well-being, and hosts a podcast for his organization called Erasing the Stigma, Accommodations in Mental Health. And you can access that podcast from our website under the program information, again, virginiaability.org. So if you've not already done so, please enter your questions. And Mark, I will turn it over to you to facilitate the panel.
Thank you, Bob, and it's really terrific to be with everybody. A little bit about my background is I practiced law for about 25 years, and then I left to run a legal services company, and then ultimately to come to Major Lindsay to help build a consulting practice. Most relevant to here is my passion, or my night job, which is advocating for wellness in the legal profession. Kristen had some really stunning statistics on how the incidences of anxiety, depression, and other mental health illnesses have manifested itself during the pandemic. With the legal industry, the truth is it was in crisis, and it was an epidemic of mental illness and anxiety disorders and substance abuse well prior to the pandemic, and the pandemic has only exacerbated that situation based on the most recent surveys that have been done. My own story is that I went undiagnosed with bipolar disease until I'm 40. So luckily I've had 19 years of the appropriate care, but I am a mental health survivor. And also relevant to coming back to the workplace, I was gravely ill and spent 7 days in the hospital with COVID. So I am really interested in people being to re-enter the workforce and deal with the stress. I think my first question for Lisa and Kristen is around the topic of normalization. One of the ways of erasing stigma is to normalize the fact that mental illness isn't a personal failing or a defect, and it's not uncommon. It doesn't hit just the unlucky. What are your thoughts on how to normalize it so that people no longer feel like they are the one unlucky person on earth that's depressed or struggling?
Well, as you mentioned, I believe, hosting open communication about it. Again, as I mentioned before my presentation, people like you or leaders, telling their own stories of how they've experienced mental health, or how it's impacted them, either currently or over the years. Another thing that I would personally do with my colleagues is I tell them, like, if I'm stressed or I'm anxious, here's what that looks like on me. And so I do that to, one, have them aware of like what my signals of distress are, but also to normalize, like, everybody gets anxious or overwhelmed at times. And so let's talk about what that looks like for one another, because it looks different on everybody. So again, I encourage that open communication to help kind of facilitate that and to normalize it.
And Mark, I would say, as a person who's a recruiter, you got to look at it on both sides. The employer that's interviewing and the applicant. Right now, there's a high number of unemployment, and I see it every day talking to candidates who are been laid off. And so the stress and anxiety of that, not just to mention regular stress and anxiety, and going to an interview. I think one of the things I always talk to my applicants about, it's okay when you do that meet and greet, whether it's video or in person, and just say, I'm excited to be here, but I'm a little nervous. And it's okay to be honest. Another thing is talking to the hiring manager, and we do, as recruiters, we do an intake strategy session with our hiring leaders and review, the job and all the details, but going over what does that interview process look like, and reminding them that interviewing is, a place where a lot of people have anxiety and they may not put their best foot forward. So in turn, make sure as a hiring leader that you have that small intro talk, and let them know, let's just talk, let's be comfortable, relaxed, just kind of put that person at ease. And remember, a lot of times the hiring manager is nervous as well. So
that's a great point, is that the hiring manager can be just as nervous as the candidate. I also like the notion that I've sort of extracted from what you said about an interview being a conversation and not an interrogation. And that has, I think, everything to do with how we train people to have a style of interviewing that encourages openness.
You'll be surprised how many times interviewing, they'll say, I want a panel. Now, of course, right now, where a lot of us are all remote, but I will go into the room or I'll talk to them and they say, oh, well, the 5 of us are going to interview the one person. It feels like a firing squad, especially if you're all on one side of the table and you got the person on the other. It's like, no, you have to make it conversational. So when you're in person, you need to sit in a circle, even if it's a round table. Don't put the interviewer on one side and you all on the other side. And as well as it kind of could feel like a firing squad when you're looking at it virtually like this. So bear that in mind, try to put yourself in their shoes and think about what it feels like for the experience.
Thanks, that is great insight. And kind of tying together with normalization is understanding the destructive power of language. And I think Kristen talked about this in her presentation. And I remember hearing a podcast a very long time ago. Well, not that long ago. It seems like a long time ago. where a fitness instructor who had a group fitness class would sometimes use the phrase, "We're going to be psycho today." And then finally, one of her clients came over and said, saying words like psycho or crazy or the like is really is really doing a disservice to the people in the shadows who struggle with legitimate mental illness. And how often in the workplace do we describe an employee who has an off day as he or she is bipolar or they're really crazy? And in truth, they may not or they may be, but many of us do have mental illnesses that aren't prevalent. What's the danger of not finding ways to mitigate use of that language?
Well, as I had mentioned in the presentation, also, it can really, discourage employees or, individuals for seeking help or disclosing their own struggles, and kind of keep them in the proverbial shadows. It also, dehumanizes, I feel, that person, and it takes a step further away from normalizing mental health challenges. And so, I think that it could have a huge detriment on individuals that are experiencing that and they hear that type of language being, kind of thrown around so candidly within the workplace. And again, like I use the example of using person first language, that's, huge for me. I correct people. And so I think that, as being an ally and somebody that is, in the mental health profession, being able to, correct people and, educate them on what proper language and etiquette is important too. So, I think that it's a team effort to be able to, call people out on that, in a respectful way, in a productive, constructive way. However, again, just to reinforce that wellness work culture.
Yeah, I think that's a great point. Lisa?
I think it's really important to maybe, especially if you're interviewing with a group of people, is to make sure you have that discussion. Or if you're a hiring leader and you have a 3-step interview process, to meet with that group and discuss these issues, because you don't want to create bias and you don't want to alienate. And it's something very real to talk about, because I think people aren't cautious or have been made aware of what is offensive.
Yes, I think sometimes we treat words like they're disposable, right? They're throwaway words that we can toss away and that they don't have any lingering effect. When the truth is, the words can have a profound lingering effect. And Kristen, I love the concept of individual first communication. I think I was inadvertently exposed to it by my daughter, who's 26, a brilliant scientist, when I commented on someone being a homeless man. And she said, "Dad, is a person experiencing homelessness." And normally when she corrects me, I have sort of an autonomic response, like, "Would you just leave me alone?" But for whatever reason, that vignette just hit home with me. And I think the context of characterizing a person with a disability as opposed to defining them by the disability is so important.
Absolutely.
So in terms of mental health etiquette, what are some of the most effective ways of training people to be more cognizant? And Lisa, I love the fact that you actually approach the interview process as a sort of a dual process of preparing both the candidate and the interviewee, so they don't use this quote disposable language. But Kristen, what have you seen work?
So I haven't seen this in the field yet, but one thing that I've, talked to human resource personnel about is let's incorporate that training, during the onboarding process. And so, we're actively doing it with, current employees, but let's also do it within the onboarding process so that employees that are, entering that particular workforce have an understanding of the precedents and, you know, what kind of workplace culture this organization is promoting. And so again, you know, the resilience training, as I mentioned in the presentation, would be a great way to kind of shed some light on mental health challenges, as well as ways to combat that, strategies to combat it. So, you know, the important thing to think about here is, yes, we can educate individuals on, you know, different challenges around anxiety and depression, but let's give them the tools too in order to better manage those symptoms. The goal isn't to, you know, eradicate symptoms of anxiety and depression, because that's, you know, nearly impossible, because life happens and stress happens, but more so focusing on being able to better tolerate distress when it does happen. So again, taking that proactive approach and teaching the strategies, the tips of building resilience, and in efforts to have our employees or whomever to be able to better tolerate distress when it does occur.
That is really great. Lisa, do you have anything to add to that?
You know, as someone who's, you know, I deal with the hiring and the recruiting process. My first thought is what I've always done, and it's been a long practice, is, you know, identifying some of those triggers that I'm hearing from the applicant, somebody who's looking for a job. And one of the things I've always had a conversation, if I'm coaching and talking about a top candidate and I know they're a good match, you know, is there anything I can do to help you prepare for the interview? And a lot of times, especially if I'm thinking about it's an internal staff member and they're actually communicating with maybe the EAP unit, or they're communicating with the HR business partner, you know, maybe a good idea would be, can we do a trial run interview? Set them up with somebody else in the company to just meet and greet. I call it meet and greet. I don't call it an interview. And that is a good way to overcome some of those fears and anxieties. And then afterwards to say, how did it feel? What did it look like? What could we do differently?
That is great advice. I think empathy and advocacy are two of the great things. The other thing, Kristen, I think I picked up from what you're saying is, if we give resilience training and teach people how to cope better, they'll be able to kind of pay it forward and help others cope better. We improve everybody's coping skills by investing in that training.
Correct. So one type of analogy I always like to use with my clients is, you know, we have this proverbial cup, and if we're low, it's hard for us to pour into others and able to support them and bring them up when we're left with nothing. So it starts with us and building in self-care. So then we are able to give to others. And, you know, I just think it's important. Again, you know, we hear the word self-care all the time, but, you know, we can do certain things to promote self-care, you know, such as like getting a massage or things like that, you know, which is all great. But I think really what's important to consider when we're engaging in self-care activities is being intentional about it. So for example, for people that are, you know, at work, you know, not eating your lunch in front of your computer, you know, because it's more than likely we're not being more productive by doing that. And we're just kind of robbing ourselves of taking a break and taking a mindful moment. So going outside, being intentional, sitting outside or sitting away in a space, you know, whatever's going to fill you up. If it's, you know, eating lunch with coworkers and conversing, or, you know, taking that time to yourself, whatever it looks like that works best for you. But again, being intentional about it. And that way, you know, you're giving yourself a break, and just being able to find those little moments throughout our workday to where we can like intentionally, you know, engage in self-care and give ourselves, you know, mindful moments.
Yes, I think that's so important. And my mantra is, you need to know yourself before you can care for yourself.
Exactly.
Now we have a bunch of questions coming in, and since this is a listener-centric podcast, I'm going to put out some of the questions, and it's like a rugby scrum. One or both or any of you can answer. The first question is, as businesses reopen and employees ready themselves to return to work, is your business prepared for this new reality and the challenges that come along with it? And Lisa, that's probably a question that tailors well to you. Kristen, I hope given the nature of your work, you guys are prepared. But Lisa, can you share some of the Anthem view on return to work and how it's being managed?
Right now, the associates are first in mind in our safety and health and well-being. We have a specific team that is monitoring the status by location, and they're working for the health and safety. They're actually nationwide reviewing every position at Anthem and whether we actually really need to be in the office or do we need to be work at home. And if we need to be in the office, do we need to be in the office 10 days a month or 10 days a quarter? So it's something that we're really looking at. We don't have a place where we have said, you're going back. We're still being cautious.
Yes, and I think that some of the data coming out of my stress and anxiety is very high because most of the major firms have said we are going back to work in September and we expect that the majority of your time will be spent in the office. And so some of the feedback we're getting is, well, I'm afraid of public transportation, or my clothes don't even fit anymore, or I don't know who's vaccinated and who's not vaccinated. So I think, it sounds like Anthem is taking a very surgical approach to looking at the essence of who needs to work in the office, what the local health conditions are, and the nature of the roles, which sounds like a really well-calibrated position. Kristen, are you seeing any trends among employers in how they're readying people to go back to work from your vantage point or the vantage point of your colleagues?
So in thinking about some of my clients that, work out in different businesses, a lot of them are, working in service industries and hospitality and things of that nature. And so some of those organizations, what they've done is, mandate that they, individuals still wear the mask, that they still social distance. Maybe they've rearranged like the community spaces, that way it's like more safe, I guess, of an environment for those that do want to spend time in there. Perhaps, providing more stations for, hand hygiene routine and PPE, as well as set up stations for taking temperatures upon arrival and being able to record that or report that to management. Those are some of the ways. And then also personally, I provide therapy in the evenings with clients, and I'm still working telehealth with those clients. However, I know that the group practice manager that I work for has had individual conversations with each of the therapists about their comfortability level and trying to arrange schedules to where, it's a hybrid approach, half, some of the time in the office, some of the time online based on client needs, but also based on our individual comfortability levels with returning to in person. So again, just that open communication about, what we feel comfortable with, as well as, what's needed of the business and the role of, what we do.
Thank you for that. We have a question about whether your organizations have policies in place with respect to diversity, equity, and inclusion. And I think really what I want to do is modify that a little bit and say, how correlated is addressing, mental wellness and accommodation of people with mental and emotional health issues tied in with diversity, equity, and inclusion? Because it seems to me like it's a subset of the DEI and implicit bias programs that the company might have.
Well, the first thing that comes to my mind is the Americans with Disabilities Act, the ADA. And so, of course, there is, legislation and policies, that businesses are required legally to adhere to, so if an individual has a mental health diagnosis, and they disclose that to human resources, they are entitled to those reasonable accommodations. However, the key point being, if they disclose that to human resources, or if they have that on file. And so, I consulted with this one individual who worked for a large university within Virginia for several years, and she had a episodic depressive disorder. However, that was not disclosed to human resources, and there was a change in her medication, which it made her feel not quite herself, so she had to miss a prolonged period of time from work, and she was not protected by the ADA because she had not disclosed that to human resources. So it was an unfortunate situation where she lost her job. However, again, that's why disclosure is so important, so that people can get the right support or the appropriate support that they may need.
And I think you've just made a really important point, is there is legal protection if you go to your human resources group and you disclose your condition, that it is that you're entitled to certain benefits and you're entitled to certain accommodations and practices, which is all the more reason to promote open dialogue and a permissive environment for disclosure.
That was well said. I was going to say, it all comes down to honesty and being real with yourself and, protecting yourself. And a lot of people, I think that's another barrier, is letting go of that and being honest to come to HR and document that.
Yeah, I think that people are afraid of the proverbial note in their file that they have a condition.
And exactly, but you know what? As you pointed out, the biggest thing is by being honest, you're actually protecting yourself with the law.
Yeah, and I think that's something that really rarely gets talked about. We talk about all types of programs to include for yoga or meditation or wellness, but we never really fully are good at advising employees that if you have an issue and you talk to your human resources group, you are entitled to, reasonable accommodations, and you're entitled to a lot of things. I don't think that gets very, very often addressed in the dialogue.
No, advocating for yourself. I think that's the one thing we could encourage everybody to do.
Absolutely.
Lisa, when you were talking about preparing people to interview as well as preparing the candidate, was that really kind of one way in which you were trying to make sure that implicit bias wasn't factoring into the interview process and the decision-making process?
I think helping and preparing a candidate be the best person they can be, to show off their talent and make them feel comfortable with who they are and how they present themselves, and that they are protected if they have disclosed that, and then finding a way, if they've disclosed that, to make them feel comfortable in expressing their experiences to be the best candidate for the job.
And I would suggest that the preparation of the interviewers is just as important.
Exactly. One of the things we do at Anthem is the recruiting staff having that strategy intake call with the hiring leaders. And it's not just a time to discuss what are you looking for, what are the experiences you're looking for, and where would you like this person to sit, because we're of course national, but going into, biases, diversity, how does it feel in the interview? Are you prepared with who's going to interview, how they're going to interview, and what questions? And you know, it's not a matter of finding the person for me, but I also have to prepare the team that's interviewing and accepting the person I'm bringing to them.
Yeah, I think that that is so important. And in fact, it's serendipitous that yesterday I was on a firm-wide call on implicit bias, and we had to take the entire Harvard battery of implicit bias tests. And they do actually suggest that a lot of us have more prejudices or biases than we think, which is what makes, I think, workplace awareness so important. Kyle, are we ending at 11? Is that our end time?
Correct. Just a few
So
more.
one of the things I want to touch on, I think we've covered most of the questions, or in fact, maybe all of them. One of the things I want to touch on is, Kristen, in your presentation, you laid out a number of different types of, mental health conditions. But I think one of the things that gets overlooked, partially because of how we name things and partially how we talk about things in the context of the pandemic, is understanding that many mental illnesses are actually a biological disease and a medical condition. And does that factor differently in the way you approach employees when you're making disclosures?
So it can, if we're looking at it from like a medical model, it certainly can. And so for me, as a rehab counselor, I have many different hats. And so when I work with a client who, has maybe, a intellect or developmental disability on top of a medical condition such as diabetes, in addition to, anxiety, it definitely, all of that kind of factors into each other. And so that's something that I have to consider, especially when, working with them in an employment setting. And, I personally make sure that I'm addressing each of them in their own right, each of the different facets or diagnoses in their own right, but also, I'm a big believer in, the mind, the body, soul connection. And so, in efforts to, help to manage or even decrease or mitigate some of those, anxieties or depression, some of those other mental health co-occurring conditions, would be to kind of address, the person and exactly what it is that they're experiencing. So if they're in an environment that is extremely chaotic, it can have a significant toll on, their physical health, which can then have a toll on their emotional well-being and psychological health. And so it definitely is something that kind of comes full circle, and that we have to look at
Holistically.
Yes, exactly. You took the words right out of my mouth. From a holistic standpoint, absolutely.
Great. Kind of my last question for both of you is, what do your organizations do to get patients for access to care? Because from what I've read, what I've talked about with my own therapist and guests on my podcast, is that they're at capacity and they're actually running out of people to refer patients to. Are you seeing that manifest itself?
So referring patients to like outside
Finding someone to refer them to, actually.
Oh, okay. So I would encourage businesses and, leaders to have partnerships within the community with just different like group practices or centers. So, I have, as a rehab counselor, I have colleagues and individuals that I've connected with in the community that provide counseling services, and that I know that can work with individuals with developmental disabilities, because that's the population that I serve. So I'm able to then, connect them to those services. Or, really just having a person in-house that can do that case management would be helpful too. And so that way they can become familiar with all of the resources within your local area, such as like the crisis center, community support center, local group practices, things of that nature, so that you have someone that you can go to, one for expertise and information, as well as to be able to refer individuals to. So creating those partnerships within the community is important.
So I think that much like Lisa prepares the interviewers, employers have to prepare by having done some work to make sure that there's actually access to providers and that they have programs in place, because otherwise it could take, I personally know people that are waiting 5, 6, 7 months for an appointment with a psychologist or psychiatrist.
Yeah, absolutely. The need for providers right now is, it's huge. However, that's something that EAP, if your organization has an EAP, they can connect you to a provider within, your health insurance network that'll best fit you. And, there's also residents in counseling and other therapists that, are licensed professional counselors that aren't just psychologists or psychiatrists that, are able to also provide that therapy, that support, and that are just as qualified and experienced to meet the needs of the individual.
Well, thank you both for an extraordinary discussion. I know everyone's busy, so we don't get time to rehearse and game plan these things like we would in another world. But your contributions have been fabulous. Kristen, your presentation was fabulous. And I'm going to turn it over to Bob.
Great. Hey, great discussion. Good questions that came in. Before we lose our panelists, I'm gonna pose a question to each of you. Just one question. My employer is, we don't have an EAP. We haven't started the conversation. I know that we're in need of, having this kind of dialogue. What's the one thing you would recommend I do, perhaps, to sort of help get this kick-started in my organization? I'll start with maybe Kristen.
So to get it kick-started, I would in efforts to kind of create an EAP, or at least something similar to where you can still have access to an individual that will have extensive access to resources within the community. Again, kind of having one personnel or a team of human resource personnel to be able to connect with the community providers and be able to provide those resources to individuals if they were to come to them. I'm not sure exactly how to create an EAP with, from an organizational standpoint. However, I think that, if you're presenting this to other leaders, coming in with some statistics, some baseline information, like, hey, this is, again, taking the surveys, understanding what your employees need, and then you can kind of shape the discussion based off of those needs. I'm hearing that they need more access to childcare to alleviate caregiver burden, or, more groups and things of that. And that way you can kind of really build up your arsenal of resources that target specific needs that your employees are saying that they have.
Awesome. Great. No, thank you for that. And I'll let the others two respond quickly before we run out of time. Lisa, you have one thing you'd recommend?
Yeah, we actually have several things that touch employees. We have a very rich, robust EAP program that allows a certain number of free visits for each associate. And not only does our EAP includes learning and sending the associate books and things, whether it's caring for an elderly parent, childcare, moving, finance, emotional health, But one of the things I wanted to share that we have is and everybody has an internal website or intranet. We actually have an app that pops up every once in a while on your computer, and it says rate how you're feeling today, and it's the happy faces with sad, like a 1 to 5 rating of a smile, and you can put some words or you don't have to. And so it's taking the temperature of the associate, and it gets fed anonymously to the hiring manager, so they know the people on their team what they're feeling.
Yeah, that's a great idea.
I really like that.
Yeah, that's a great idea. I've seen that work. Mark, from your personal experience, what would you share?
Yeah, a couple of things. You typically have to contract with an organization to provide an EAP, and you may or may not have the means to do that. But there are other things. Kristen made mention of surveys, and taking a survey gives you baseline data. And one of the things you can do, and our organization does a lot of, for all sorts of groups, from the LGBTQ community to mental health community, or employee resource groups, where internal champions within the organization believe in the cause and they want people to have a safe place to have a dialogue, and they want to communicate information. So these employee resource groups aren't contracted with a third party. They're really communities within the company with champions. That's another way. There's no perfect way, and there's very few organizations that can do everything. Ours can, because we're part of Allegis Group, which is the largest privately owned human capital company in the firm. They're $14 billion. Companies don't have that luxury of adaptive things that they can do.
We actually have those associate resource groups at Anthem, and we have 9 of them, and they're very active. That's a volunteer. It's a great way to network. It's a great way to share your feelings and express things. And they do volunteer work as they design, as the club chooses, and their activity and their association at the RG group.
Yeah, definitely a great resource, for internally for organizations. So thank you all again for participating in our webinar today. Thank you to our participants. Virginia Ability is a business-to-business association, and we're focused on helping businesses and our community build inclusive cultures through, a diverse workplace for people with disabilities. So reach out to Virginia Ability if you didn't get your questions answered, or if you're looking for more information, please reach out to us. We'll be sending out a post-webinar survey and encourage you to respond. That will also maybe allow us to, track progress or see how we can support organizations in this topic going forward. Also, I hope you'll join us in July for our ADA. It's our annual ADA legal update, where we will be focusing on post-pandemic, the future of accessible working. And our presenter will be Stephen Brown, a partner of Eisler Dare Law Firm, who presented last year and will do an excellent job. So look forward to seeing you there. And again, thank you for joining us today.
Thank you, Bob. Thanks everyone for tuning in.
Of course.